Structured support for weight management after treatment. Imagine this. You've worked hard, followed your weight management program to the letter, and finally reached your goal. But here's where it gets controversial. What happens next? Many people find that without the right support, they regain the weight they lost. This isn't just about aesthetics, it's about health. Regaining weight can negatively impact both physical and mental well-being. That's why our independent committee is urging healthcare services to offer structured advice and follow-up support after weight management treatment ends. Research shows that without proper help, many people struggle to maintain their weight loss. To address this gap, a new standard has been set out, clearly outlining expectations for healthcare providers. This includes offering ongoing advice and tailored action plans. Think of it as a roadmap that covers everything from regular check-ins and practical strategies to support sustainable routines, social support, and accessing community help. This support could come in various forms. For instance, online access to the NHS Better Health platform, working alongside a healthcare professional like a dietitian or nutritionist to create an action plan, or joining local peer support groups, such as Keep Fit or walking groups. These resources are designed to help individuals maintain their progress and avoid slipping back into old habits. This guidance is particularly timely as new weight loss drugs like semaglutide, Wegovy, and tirzepatide Mounjaro become available to those with the greatest need on the NHS. Around 240,000 people are expected to be offered tirzepatide over the next 3 years. But here's the thing. Successful weight management doesn't end when medication stops or when someone completes a behavioral program. The transition period after treatment is crucial, and people need structured support to maintain the positive changes they've made. This new standard ensures that services provide that vital continuity of care, aligning with the NHS 10-year plan to shift from a sickness service to a genuine health service focused on prevention. Under the new guidance, healthcare teams should monitor people for at least a year after they complete treatment and offer extra support if needed. This could include practical advice from programs like NHS Better Health on changing daily habits or making adjustments at home or work to avoid slipping back. Weight management is a long-term journey, not a short-term fix. The evidence is clear that advice and support for maintaining weight after stopping medicines or completing behavioral interventions can help prevent weight regain and enable people to experience lasting benefits. We've seen excellent examples of services that already provide comprehensive discharge planning and ongoing support. This quality standard will help ensure all healthcare providers adopt these best practices, giving every person the best chance of maintaining their weight management success over the long term. The updated standard replaces 3 previous standards and reflects the most up-to-date thinking on how to tackle overweight and obesity through the health system. It emphasizes continuity of care and highlights the importance of helping people build long-term behavioral habits, use self-monitoring tools, and draw on wider support from online communities to family-led interventions and local activities. The scale of the challenge is clear. In England, 29% of adults are living with obesity, and 64% are classified as overweight or obese. Obesity is known to increase the risk of a number of serious conditions, including type 2 diabetes, heart disease, some cancers, and musculoskeletal problems. With rising prevalence, this places growing pressure on the NHS and the wider economy. Estimates suggest that obesity costs the NHS £11.4 billion a year, with a wider economic impact of £74.3 billion due to lost productivity, unemployment, and increased demand for social care. Healthcare providers and commissioners are expected to begin rolling out the standard immediately. Resource impact guidance is available to help services embed the changes locally. The full quality standard is available on the NICE website and provides detailed implementation advice for services across England and Wales. And this is the part most people miss, the importance of ongoing support. It's not just about losing weight, it's about keeping it off. So what do you think? Should healthcare services be doing more to support long-term weight management? Let us know your thoughts in the comments. Weight loss drug users should get year-long support, new guidelines suggest. Imagine you've just shed those stubborn pounds with the help of groundbreaking weight loss injections like Wegovy or Mounjaro. But here's where it gets controversial. Experts are saying you shouldn't just walk away from your new healthy self. In fact, a watchdog organization is advising that you should be monitored for at least a year after stopping these medications to prevent the dreaded weight regain. And this is the part most people miss. The importance of long-term support in maintaining your hard-won results. The National Institute for Health and Care Excellence, NICE, the trusted healthcare advisor in England and Wales, has issued new guidelines emphasizing the need for continued support after weight loss treatments. This isn't just a suggestion, it's a mandate for healthcare providers to offer structured advice and follow-up support to patients who have completed their courses of Wegovy or Mounjaro. Now, let's put this into perspective. Approximately 1.5 million people in the UK are currently on weight loss injections, with a significant portion paying upwards of £200 each month out of pocket. Meanwhile, the NHS plans to roll out Mounjaro, also known as tirzepatide, to around 240,000 individuals with the greatest need over the next 3 years. These aren't just numbers. They represent real people counting on these treatments to transform their lives. According to NICE's latest quality standard, healthcare providers must keep tabs on patients for at least a year post-treatment. This might involve anything from personalized advice on healthier eating habits to joining local fitness classes or even finding ways to incorporate exercise into their daily routines at work or home. The idea is to build sustainable, long-term behavioral changes that will keep the weight off for good. Research paints a promising picture. Studies show that semaglutide, the active ingredient in Wegovy and Ozempic, can lead to a 14% reduction in body weight over 72 weeks. Similarly, Mounjaro, often referred to as the King Kong of weight loss injections, can result in a 20% reduction in body weight over the same period. However, the flip side is that many people tend to regain weight if they don't receive adequate support after discontinuing their medications. This is more than just a matter of aesthetics. Weight regain can have serious implications for both physical and mental health. Professor Jonathan Benger, Deputy Chief Executive and Chief Medical Officer at NICE, puts it succinctly. Successful weight management doesn't end when medication stops. People need structured support to maintain the positive changes they've made. In England, the statistics are alarming. 29% of adults are classified as obese, and 64% are either overweight or obese. Obesity poses a substantial burden on the NHS and the broader economy, contributing to higher risks of conditions like type 2 diabetes, heart disease, cancer, and musculoskeletal issues. It's estimated that obesity costs the NHS £11.4 billion annually, with an additional £74.3 billion in economic losses due to lost productivity, unemployment, and increased demand for social care. Dr. Rebecca Payne, chair of NICE's Quality Standards Advisory Committee, underscores the importance of long-term weight management. The evidence is clear that advice and support for maintaining weight after stopping medicines or completing behavioral interventions can help prevent weight regain and enable people to experience lasting benefits, she explains. This quality standard will ensure that all healthcare providers adopt best practices, giving every person the best chance of maintaining their weight management success over the long term. Professor Kamala Hawthorne, chair of the Royal College of GPs, adds a critical perspective. There is no one-size-fits-all approach to tackling obesity. What works for one patient may not work for another, and weight loss drugs come with their own set of risks. Patients will need ongoing support to sustain their weight loss once they stop taking the medication. Henry Gregg, chief executive of the National Pharmacy Association, agrees. Pharmacies play a crucial role in providing full wraparound support to patients aiming to achieve a healthy weight. While medication can accelerate weight loss in some cases, it's not a magic bullet. Patients need to make long-term lifestyle changes to maintain their weight loss. In conclusion, The new guidelines from NICE highlight the critical importance of long-term support in weight management. As we move forward, it's essential to remember that weight loss is a marathon, not a sprint. By providing structured advice and follow-up support, we can give patients the best chance of maintaining their weight loss success and improving their overall health. So, the next time you hear about weight loss injections, remember that the journey doesn't end when the needle does. It's just the beginning of a lifelong commitment to a healthier you. NHS Fat Jab Guidelines 2025. Are you eligible? Weight loss risks. Aftercare explained. Weight loss injections are transforming lives, but experts warn they're not magic bullets. New NHS guidelines demand urgent changes to prevent patients from regaining weight. Are you getting the right support? The National Institute for Health and Care Excellence, NICE, has issued a critical update. Over 1.5 million Britons using medications like Wegovy and Mounjaro for weight loss now require structured follow-up care for at least 1 year after treatment. Why? Studies reveal a harsh truth. Without ongoing support, most patients regain lost weight within 2 months of stopping injections, often returning to their original weight within 2 years. But here's where it gets controversial. While NHS patients receive monitored care, private prescriptions, which dominate the market, frequently lack nutritional guidance or exercise plans. Professor Jonathan Benger, NICE's chief medical officer, stresses, weight management isn't a sprint. Stopping medication without a transition plan is like removing training wheels before someone can balance. Patients need continuous support to sustain healthier habits. The new standards mandate NHS clinics to provide personalized action plans for diet and workplace health, regular check-ins, in-person or virtual, access to community resources for long-term lifestyle changes. Dr. Rebecca Payne of NICE adds, "This isn't about quick fixes. Evidence proves post-treatment support drastically reduces weight rebound. Yet critics argue this highlights a systemic flaw. Should private providers face stricter regulations to match NHS standards?" The weight loss injection breakdown. What beginners need to know. 1. How they work. These injections mimic GLP-1, a hormone that signals fullness to the brain. By slowing digestion and boosting insulin production, they reduce appetite and blood sugar levels, a dual effect that originally made them diabetes treatments. 2. Access rules. NHS typically requires a BMI greater 30 plus weight-related condition, e.g. hypertension. Private. Available for BMI greater 30 or BMI 25 to 30 with health risks. Recent crackdowns now require video face-to-face consultations to prevent misuse. 3. Risks beyond the hype. Common side effects. Nausea, bloating, constipation. Affects 50% of users. Rare but severe risks. Pancreatitis 1 in 500, kidney issues. Gallbladder problems. The elephant in the room. 85 UK deaths up to January 2025 were tentatively linked to these drugs. While causation remains unproven, it raises urgent questions about mental health impacts and long-term safety. And this is the part most people miss. These drugs don't melt fat, they help reduce calorie intake. Without addressing underlying habits, results fade fast. Controversy alert. With private clinics charging thousands and NHS access tightly restricted, is this creating a two-tier system where only the wealthy sustain weight loss? Worse, are we normalizing medication as a first resort instead of tackling root causes like food quality or sedentary lifestyles? Final question to you. Do the benefits of these miracle injections outweigh the risks and costs? Could better public health policies reduce reliance on pharmaceuticals altogether? Share your take below. We're eager to hear where you stand in this heated debate.